Hello, today is June 1st, and we're grateful for the lovely weekend we had. The weather was beautiful, and we're also grateful that the number of COVID-19 patients at our hospital continues to decline. With me today is Candi Wroblewski, Director of Case Management. The case managers and discharge planners at Silver Cross have played a key role at the hospital throughout the COVID-19 pandemic. So, Candi, okay to take off our masks?
Yes.
Okay. So why don't we begin by describing your department? How many employees do you have?
Thanks. We have just over 40 employees, and we have case managers and discharge planners. So case managers do utilization review, so they actually call the insurance and provide the insurance the updates of why a patient's in the hospital. And then there's also case managers on each unit that help with care coordination of the patient throughout the stay, and they help with kind of navigating the stay for the patient. And then the discharge planners, which are social workers, actually help with the discharge planning, and they play a key in the psychosocial aspect of the patient's stay.
Wow, a lot of responsibility for that team.
Absolutely.
Yes, and how do they work with the nursing team on the inpatient floors?
Well, they work very closely with the nursing team because they actually coordinate with the nurse about the discharge. So they'll let them know exactly what plan is identified for that patient and what they need to do at the end of the stay. They may have to call a nursing home and provide report to that next level of care so that we have a good transition of care.
Okay, I bet most people don't realize when they have an inpatient stay that there's going to be all these other folks that help them leave the hospital and prepare to go home.
Right. I think there's a lot of extra steps within the stay that people don't actually realize.
Yeah, that's wonderful. So during what we call normal times, What does the workload look like for your team?
So they actually meet with patients at bedside and talk about what the next level of care looks like, and they meet with families. So usually the families are at bedside and helping to navigate going to nursing homes and viewing the nursing homes to see exactly where they want their loved ones to go after discharge.
Okay. Do they work with the home care team as well?
Yes, they work closely with the home care team. A home care liaison will come and see the patient and actually help them transition to home care as well.
Okay. All right. Very complicated. Well, with the onset of COVID-19, what changed for your team?
Well, COVID-19 had some barriers because when it first started, there was a hard time finding places for the patients to go. So the nursing homes and rehabs and other levels of care really didn't identify that they could take these patients. So as we worked closer with them, we were able to identify which facilities could accept a patient and actually make sure they had the proper PPE to take care of that patient as well.
Right. And how about people discharging to home? How did you prepare them and their families?
So a lot of it was on the telephone because we really can't meet with those patients at the bedside as well as their families. So coordinating with them, maybe sometimes coordinating to make sure that they have what they need, which kind of equipment, and describing what the patient's needs are going to be because they really weren't able to see that patient at that time.
And we've read a lot in the news about outbreaks in nursing homes or skilled facilities or assisted living. How are those facilities doing in our community?
So they've been doing a really great job. They've limited all visitors in the facilities as well. They take temperatures on their staff twice a day, and they're making sure that their residents are exhibiting any symptoms, that they're checking them early on to make sure they isolate them. So they've really been working closely with us and making sure that they have a safe plan for the patients.
I know we have several physicians that visit the skilled facilities. Have they been able to go?
So they're doing a lot of video visits right now at the nursing facilities. So they're using technology to help them.
So Candi, in conclusion, is there anything you would like to say to your team?
Yes, I really would like to let the entire team know that they work really great with families and patients and helping to make sure they identify an appropriate level of care at discharge. We've had to have some creative plans a little bit more than usual because not able to accept the equipment at the hospital or having the equipment delivered to the home. So we've really been creative in what we do for discharge planning right now.
Well, thank you. And thank you, everybody on the case management team, for all your hard work.